a genetic standpoint, it is predicted that about 1 out of 500 individuals can have the genotype. That being said, it's been estimated that as few as 1 out of 6, maybe even 1 out of 7 people with hypertrophic cardiomyopathy have actually been identified as having that condition. This gets complex pretty quickly because simply having the genetic abnormality doesn't mean that you will demonstrate clinical evidence of disease. And so there may be individuals who have inherited a genetic abnormality that puts them at risk, but they ultimately don't develop the disease and may never manifest symptoms at all. The interplay between our environment, our genetics, is obviously true for a lot of inherited conditions. It's not completely clear why some individuals with one genotype in a family will develop more severe manifestations of a disease and others will not. So there are perhaps environmental factors that may influence that. There are also multiple different genetic abnormalities or genotypes that underlie the phenotype or the characteristic finding of thickening of the walls of the heart that often will manifest with symptoms that are related to limited blood flow getting out of the heart. So hypertrophic cardiomyopathy is a broad umbrella term for which there are varying genetic abnormalities that underlie it. Even more complex is the fact that 2 individuals with the same genotype may have different clinical presentations, and individuals across genotypes, different genetic abnormalities, may have different presentations.